Angeles area is Sandi Kuehn. She's the CEO and president of Center for Addiction Treatment, which is a nonprofit. And Sandi Kuehn, welcome for the first time to the Bill Cunningham Show. Sandi, how are you? Sandi, how you doing?
I'm good, Bill. How are you?
I'm doing well. Let's, in general, talk about the seriousness. What is the level of seriousness of the opioid, which is prescriptive drugs and heroin problem that you see every day in the tri-state?
Well, the seriousness is the deadliness of it. I mean, we're losing people, and these are young people, every day.
Yeah, literally. And as far as the distribution, I have on other experts who say it's not just heroin, but it's also addiction to prescriptive drugs. Explain the difference.
Well, heroin is derived directly from the poppy, and opiates or the pain pills are synthetic drugs that are based on the composition of the molecule of the opium.
So the difference is one can be legal, one is always illegal. And as far as the pharmaceutical, what would you say to Americans who have surgery planned? You might have a hip replacement, you might have shoulder surgery, you might have terrible headaches. I've had people call me over the years and say they do not want to take Percocet or Oxycontin because of a fear that they might have of addiction. Can you address yourself as whether or not those feelings are real?
I'm sure they're real. The pain pills play a very important part in our medical prescription, how we deal with pain, if you will. I mean, they have a legitimate and a very purposeful part of the whole process of pain elimination. So I think it really depends on whether or not you have a genetic propensity for addiction.
Yes.
It's something you need to talk with your physician about.
Yes.
I think there are other options depending on how severe the pain is expected to be, such as relaxation or even acupuncture, but things that are alternative to the medication. But there are actually people who do need the medication. So I wouldn't say it's all bad. It's just how do you think this is going to affect your own body?
What is the course of treatment at the Center for Addiction? Tell me if there is is there such a thing, a typical course of treatment if someone has a terrible heroin addiction? What is the course of treatment?
Well, we're fortunate in this county that we have subacute detox, which is what CAT provides on the front end. So they typically would come in for a detox period, and it will depend on how long they're in detox, depending on how much drug they've been using, how their body reacts to the withdrawal process. But typically for heroin or opiates, it'll be between 5 and 7 days. Once that's done, because detox is not treatment, it's just getting the body physically ready to go on this journey of behavior change, then they can either step down into CAT's short-term residential program, they can go into an outpatient clinic-type setting using medications like buprenorphine to help them with the behavior change process, or they can go into an abstinence-based piece of the program. There are lots of options in terms of the actual behavioral therapy that's available to patients.
So you try to tailor each treatment program based upon the actual person in front of you?
Correct. That's the ideal. You want to individualize the treatment plan to what they need, what they want. Some people could actually be better controlled on medication, but for some reason they prefer an abstinence-based program. So you're always tailoring what the patient wants and what is recommended from the assessment that we do. Do
you have some sense as far as a percentage of those who successfully come out of opioid addiction and those who do not?
Well, the addiction is a chronic relapsing brain disease. So relapse will happen most likely at some point in time for every person who has an addiction. Hopefully, the periods of time between relapse gets longer and longer. And I'm not trying to say that every single person who is addicted will relapse, but it is an expected course of the process. We view that as an opportunity to move higher, if you will, onto the continuum of the change continuum. So we don't see it as a negative. We see it as another opportunity. And you'll have to consider that since this is a chronic disease, the relapse rate for addiction is no different, actually, than for hypertension or for diabetes, all the other chronic diseases that there are.
So if a person is addicted, you're saying that over the course of the rest of their life, they will grapple with this monster almost every day of their life, even if they succeed?
Yes. Most people, you know, as time goes on, there'll be fewer and fewer triggers. They've learned how to deal with stress, especially if they've really embraced the 12-step model and joined either AA or NA. There's all those supports. So as time goes on, I mean, we have people, 50% of our staff of 70 is in recovery, and I have people here that have 30 years clean. So it's not a automatic that you'll relapse, but it is an expected course of the process.
All right, what is your phone number there at the Center for Addiction Treatment? What is your number and or the website?
Our number is 513-381-6672, and the website is www.catsober.org, so catsober.org.
Well, good luck to you. It's a constant struggle. I don't care if a person's got an addictive personality or a physical addiction, whether it's the sex or overeating or alcohol or drugs. All of us have problems. There's not a family in America untouched by the opioid addiction and what lies ahead. And good luck to you. Keep doing what you're doing, and give my best to Chip Gerhardt. He's a great American.
Thank you very much.
God bless you. Sandi Kuehn, who's the Chief Operating Officer and CEO of the Center for Addiction Treatment. And once again, that phone number or that website, if you can look it up, it's CAT Sober, which is Center for Addiction Treatment Sober.com.